Hi everyone, this is Dan with ThoroughCare. You might not know it, but on July 13th, CMS released their proposed physician fee schedule for the upcoming calendar year 2024. In this video, we're going to talk about some of the things that are really good, some of the things that are making progress in the right direction, and comments that we suggest all of you make to CMS to make these programs even better. Now, this isn't the final set of rules, but it's exactly that, a proposal with what they're suggesting the final rules might look like. Let's talk about some of the new programs that are proposed for 2024. These three programs are Community Health Integration, Principal Illness Navigation, and a Social Determinant Health Risk Assessment. All of these programs are proposed to be done by community health workers and care managers outside of the physician themselves. Social determinants of health play a big part in the proposal for all of these programs. In addition to the social determinant risk assessment, CMS is also proposing that this assessment be an optional part of the annual wellness visit. We think that's a great idea since it's the perfect time to ask these questions to the patient. Now, for a lot of these programs, we still don't know the final details. For example, what will be required, what type of resource can do it, and what it will pay. But at first glance, these programs are a step in the right direction. There are some existing programs that have proposals to improve them. For example, Remote Therapeutic Monitoring, or RTM, came out last year, and we've all had hopes that it would improve significantly in the coming year. Well, CMS is asking for proposals on how to make this program better. One in particular is making a generic code for RTM that would be outside of the existing musculoskeletal and respiratory conditions that are required for the program today. We think that's a great idea, and there could be a lot of applications for this program, such as medication adherence, nutrition, pain management, even stress management, or other subjective measures that would allow the patient to report data back to their care team. For those of you who are rural health clinics or FQHCs, CMS is proposing that programs like RPM and RTM will now be available to you through General Care Management Code GO511. While this is definitely a good step in the right direction that you could do these programs, we don't think they should be lumped into GO511. So one of the proposals we would highly suggest would be for those programs to have separate codes for rural health clinics and FQHCs. One of the possible negatives that we've seen in this proposal is that the conversion factor for 2024 is proposed to change again. Last year it dropped by about 1 to 1.5%. The proposal for 2024 is for the rates to go down by about 1.25% overall. So while this may only affect you by $1 or $2 per program, it is something to be aware of. We should note that last year a decrease was proposed, but Congress did pass some temporary relief that did keep that rate slightly higher in 2023. So stay tuned on that, but you should be aware that there may be a possibility that due to the conversion factor changing, your rate could be slightly lower in 2024. So in conclusion, the purpose of doing a video like this is one, make you aware of some of the things that are proposed. And finally, probably the most important part is giving feedback to CMS. They are asking for it, and they give us 60 days to provide feedback. At ThoroughCare, our team is putting together a list of bullet points that we think are great changes for CMS to see ahead of them making their decision in November. If you would like to participate, we would love for your practice to submit comments to CMS as well. If you found this video helpful, please make sure to like it and subscribe to our channel below. And if you'd like to be included in our mailing list to see those changes and proposals once we have them finished, please sign up for our mailing list as well. Have a good day.